So I'm Dr. André Descent. I'm a medical aesthetics expert, and we've been doing weight loss in our clinic for some years as well. We look to do the outside of people and the inside of people. That's what's crucial, and not just doing aesthetics to look good from the outside, but what helps you with longevity, live better, live longer. And absolutely, weight loss is a huge part of that, and a massive challenge across medicine the world over. And when I first came across Allurion, it was a real game change moment, because suddenly we had the way to help people, removing surgery, endoscopy, all those things which are barriers to weight loss, and it just bringing it to the world, and that's why it was so exciting. Always a barrier to weight loss, and there are many, but certainly when it comes to those more involved surgical procedures, just the thought of hospital, of general anaesthetic, of endoscopy, days out of work, these are huge things, and they make people anxious and tense, even more in COVID times. The risk of infection, post-operative complications. And here we have an amazing, cutting-edge science that you can sit in a room, and if we had started doing the process when we started talking, we'd be halfway through by now. We could have swallowed the capsule, started the filling, done the x-rays. In 20 minutes, you walk out, and potentially life is changed, and you have felt really minimal discomfort, and the next part of your journey starts, because the balloon doesn't just end there. It is, of course, the balloon plus the program that makes the difference. We treated a wide variety of patients. Clearly there are categories you have to remain within, like 18 to 65 and certain weights, but we've found patients who are BMI 27, motivated, want to use that little bit of weight just to get down to the perfect fighting weight, as it were. Plus we've gone to the heavier patient too, who's struggled, who needs to lose, say, 2 stone just to get an operation safely. They need the operation, a painful knee, they can't exercise, they can't train, they can't do things maybe we could do when we're younger, and there's not much to help them. They've tried the diets, tried the medication. Here we say, no, come to us, balloon, lose 2 stone, safely. Suddenly the world opens up in terms of surgery, anaesthetics for those things they really need, and bring them out of, say, a diabetic profile too. So we've treated men, women, 18, 60, the very heavy, the slightly heavy, it's there for everybody. I mean, the device, the balloon, we say it's cutting edge science, it's extremely clever, but like so many things, it's a tool. You have to use it. You have to use it wisely. You can buy a crazy expensive exercise bike that you have at home and will help you lose weight, but you have to get on it. You have to train, you have to spend the hours. And again, this is what the balloon is. It will work if you work with it. And you work with the nutritionists, you understand how portion control is important, you understand how exercise is vital, and you keep in touch. It's a team effort. And you, as the person receiving the balloon, you're the most important part of that team, balloon second and us third, fourth and fifth, but it's that group mentality that gets the results long term. It's great to have some tech with it, because we're all becoming more tech savvy. We have our phones, Apple watches, whatever. So this fits in nicely, because we like data, we like to see things on screens, and the app is fantastic. It links so well with the scales. The information there, it's really interesting. Your body water content, your bone density, things that maybe you wouldn't have thought you'd learn about. You'll learn about those things too. And there you can see how you might lose weight, but you don't lose muscle. So are you losing the right kind of weight? And you might think you're not doing so well, but actually you look at the figures, your muscle mass is fine, your bone mass is fine, and every bit you've lost has been the dreaded fat that's been the problem in the first place. And with the tracker, it's a nice motivational tool, keep you walking, keep you moving. It's like it's just there every day as a nice reminder, and therefore that tech is essential. When we first talk to patients, we like to find out what is the key thing you're looking for. It might be something so mundane, like just be able to swing your children around like you always thought you would be able to, or that little run just around the block that you used to enjoy. Just let's find out what that thing is you're looking for, and that's what we try to aim for. And that's when we know we've reached success, because the person rings up or says, look doc, here's a picture, I'm doing it. It can be a dress that you always wanted, or a jacket you always loved and you haven't been able to wear for 15 years. It doesn't matter what it is. It doesn't matter how simplistic or mundane it is. It's your goal. It's important to us. We'll help you get there. Yeah, fertility levels are going down. People are finding it increasingly difficult as they have children later. But being heavy is a big block to fertility. And losing 2 stone can just take you from being, in simple terms, infertile to fertile. It is that simple. To a point whereby we have to be careful on the balloon sometimes that you don't get pregnant while it's in those 4 months. So if you've been struggling to conceive and you're on the heavy side, the balloon again offers a wonderful way to drop that 2 stone, put you into that fertility band that we're looking for. There's always a role for psychology. Maybe this whole thing is psychology. People's relationships with food are complex, often embarrassing and not easy to hand over to somebody else and reveal yourself naked in that sense. But where we find there is an issue with eating, we're careful maybe not to even use the balloon because it's contraindicated for certain aspects of bulimia, anorexia. But for motivation, for understanding the triggers that drag you down when it comes to weight loss, there's a definite role for psychologists, and we do use them. Not always every case, that's not required, but where we're finding there is a block, where we're not quite getting the results we're looking for, some eating habits have just returned that are not positive, then yes, a psychologist is a great intervention.